Welcome to part 1 of our series on ankle special tests. In this video, we will discuss 5 important tests that can help assess various ankle conditions and injuries. The first test is the Navicular Drop Test. This test is used to measure pronation or arch collapse in the foot. To perform this test, stand barefoot on a flat surface and measure the height of the navicular bone in both relaxed and loaded positions. The difference in navicular height indicates the degree of pronation or arch collapse. This test is commonly used to assess foot mechanics, diagnose biomechanical issues, and guide interventions. Next, we have the squeeze test. This test is particularly useful in assessing lower leg injuries, especially in the shin area. To perform this test, the individual is seated or lying down, and the examiner squeezes the midshaft of the tibia. Pain experienced during this test may indicate conditions such as stress fractures or shin splints. It is important to note that the squeeze test is part of a broader examination for lower leg injuries and should not be used as a definitive diagnostic tool on its own. Moving on, we have the Thompson Test, also known as the calf squeeze test. This test is used to assess the integrity of the Achilles tendon. The individual lies face down, and the examiner squeezes the calf while observing foot movement. In a normal response, the foot plantarflexes. If there is no movement, it may indicate a rupture of the Achilles tendon. The Thompson test is a quick assessment for Achilles tendon ruptures, but confirmation with imaging is necessary. Next, we have the Posterior Impingement Test. This test is used to assess posterior ankle impingement. The individual can be seated or supine, and the test involves plantar flexion and inversion with compression on the posterior ankle. Pain experienced during this test may suggest impingement in the posterior ankle structures. The Posterior Impingement Test is part of a broader examination for conditions involving posterior ankle impingement. Lastly, we have the Anterior Impingement Test. This test is used to evaluate anterior ankle impingement. The individual can be seated or supine, and the test involves dorsiflexion with pressure on the anterior ankle structures. Pain experienced during this test may indicate impingement in the anterior ankle structures. The Anterior Impingement Test is a component of the examination for anterior ankle impingement, but additional evaluations are often needed.